My name is Marco Nascimento. I'm Deputy Vice President for Production and Innovation in Health at Fiocruz, and I'm also the General Coordinator of the Executive Secretariat of the Global Coalition for Local and Regional Production and Innovation and Equitable Access to Health. And it's a big honor for me today to be here representing Oswaldo Cruz Foundation and Brazil. We will have a very relevant session regarding zoonotic reservoirs and vectors today with several key figures and ministers. So to start our session, I would like to invite Minister Annie Geneva, Minister for Agriculture, Agri-Food and Food Sovereignty of France, to deliver her opening remarks. Minister, the floor is yours.
Mesdames et Messieurs les ministres, Mesdames et Messieurs les présidents et directeurs, Mesdames, Messieurs, chers partenaires, c'est une grande joie et un honneur d'introduire ce matin cette première session thématique consacrée à l'anticipation, à la maîtrise et à la réduction des risques infectieux vectoriels et zoonotiques par l'approche One Health. Ce sommet ne se résume pas à une rencontre diplomatique. Il se veut être un catalyseur de solutions et d'actions concrètes face aux enjeux de santé globale. En nous rassemblant ici, gouvernements, organisations internationales, chercheurs, acteurs du secteur privé, représentants d'ONG et de la société civile, nous affirmons une conviction forte. La santé publique ne se conçoit plus en silo. Elle est un tout indivisible au sein duquel les piliers environnemental, humain et animal sont interdépendants. En tant que ministre de l'Agriculture, je mesure chaque jour la force de cette interdépendance. Nos systèmes de production agricole et alimentaire sont à la confluence de la santé humaine, animale et végétale. Ils sont aussi étroitement liés à l'environnement et à la santé des écosystèmes. Les maladies zoonotiques qui sont de plus en plus prégnantes, ainsi que le développement croissant de la résistance des bactéries aux antimicrobiens, nous rappellent que la santé humaine ne peut se concevoir sans celle de l'environnement et des animaux. L'enjeu est d'ampleur. Nous savons aujourd'hui que 75% des maladies émergentes détectées ces 30 dernières années sont d'origine animale, impliquant pour une large part la faune sauvage. Les agriculteurs et les éleveurs sont les premières sentinelles de ces risques. Ils sont en première ligne et sont souvent les premiers impactés par les crises sanitaires. Mais ils sont aussi les acteurs incontournables de la prévention des risques et du renforcement de la résilience de nos systèmes alimentaires. La session qui nous réunit traite spécifiquement des réservoirs zoonotiques et des vecteurs. Ce sujet est d'une actualité brûlante et doit être abordé à l'échelle internationale, ce que nous offre ce Summit One Health. Car rappelons-le, les pathogènes que véhiculent les vecteurs n'ont ni limites ni frontières. Sous l'effet du changement climatique et de la mondialisation des transports qui accroît les mobilités humaines, nous constatons que des vecteurs tels que les tiques ou les insectes piqueurs s'implantent dans de nouveaux territoires et par suite, des maladies bactériennes ou virales émergent ou se disséminent à grande échelle. Je pense à la fièvre hémorragique de Crimée-Congo, transmise à l'être humain par certaines espèces de tiques ou à partir d'animaux contaminés, domestiques ou sauvages. Je pense également au virus du Nil occidental, véhiculé par les moustiques qui affectent aussi bien les oiseaux, les chevaux que les humains. Je pourrais continuer avec la fièvre de la vallée du Rift ou d'autres zoonoses virales, car la liste des exemples est longue, très longue. L'influenza aviaire hautement pathogène constitue une illustration particulièrement préoccupante des risques associés à la propagation des zoonoses, en particulier lorsque le virus franchit la barrière d'espèces. L'actualité récente nous rappelle la porosité de cette frontière. Le cas humain de virus aviaire AH9N2, identifié en Italie le 25 mars dernier, est une première en Europe. À l'instar des cas signalés en Asie, ce cas témoigne d'une réalité que nous ne pouvons ignorer. La menace zoonotique est concrète, évolutive, durable. Si le risque pour la population générale demeure à ce stade qualifié de faible par le Centre européen de prévention et de contrôle des maladies, il est en revanche bien réel pour les professionnels exposés. C'est précisément pour répondre à cette réalité que la France a fait, dès 2023, un choix fort et inédit, celui de déployer une campagne de vaccination à grande échelle des canards contre l'influenza aviaire hautement pathogène. Cette décision est un choix stratégique. En protégeant nos élevages, nous mettons en place une véritable barrière sanitaire. En effet, réduire la circulation du virus dans les populations animales, c'est réduire d'autant les risques de mutation et de transmission chez les humains. La vaccination devient ainsi un levier concret, opérationnel et pertinent de mise en œuvre de l'approche One Health. Par ailleurs, l'introduction massive d'espèces animales en dehors d'un cadre sanitaire maîtrisé, je pense notamment au trafic des espèces protégées, constitue également un enjeu important pour les systèmes alimentaires et la biodiversité. À ce titre, la préservation de la biodiversité est au cœur de ces enjeux. La santé de la faune sauvage, la perte d'habitat ou encore la prolifération d'espèces invasives modifient en profondeur les équilibres écologiques et multiplient les interfaces entre l'homme, l'animal et les pathogènes. Ces déséquilibres accroissent les risques de transmission, en particulier lorsque les interactions avec la faune sauvage s'intensifient et échappent à tout cadre maîtrisé. C'est notamment le cas du commerce illicite de viande issue de la faune sauvage qui constitue une menace directe pour notre sécurité sanitaire en contournant tout contrôle vétérinaire et en exposant les populations à des agents pathogènes nouveaux. Ebola, variole du singe, mais aussi des maladies plus communes telles la salmonellose. L'histoire nous a montré que la consommation et le commerce illicite de viande issue de la faune sauvage sont des catalyseurs de crises sanitaires d'ampleur. Face à ces menaces, une réponse isolée est condamnée à l'échec. Là aussi, l'approche One Health est la condition de notre sécurité sanitaire et alimentaire mondiale. En ce sens, la France fait le choix d'une action résolue et coordonnée, fidèle à l'approche One Health. D'abord, nous avons fait le choix d'une gouvernance renforcée. Depuis avril 2023, une task force interministérielle One Health réunit sous une même impulsion les ministères en charge de l'agriculture, de la santé, de l'environnement et de la recherche. Son objectif est clair, décloisonner nos politiques publiques, croiser les expertises et bâtir une feuille de route opérationnelle à la hauteur de la complexité des risques que nous affrontons. Il s'agit de garantir au niveau national la meilleure intégration transversale dans nos politiques publiques. C'est incontournable. Ensuite, nous avons engagé une surveillance sanitaire plus précoce, plus intégrée et plus efficace. Face à l'influenza aviaire hautement pathogène, nous avons déployé le protocole de surveillance active de la grippe aviaire, dite SAGA. Il permet de tester rapidement les personnes exposées afin de surveiller l'éventuelle émergence de souches qui se seraient adaptées à l'homme. Ce dispositif incarne très concrètement ce que doit être l'approche One Health. Une coopération étroite entre les services vétérinaires et les autorités de santé humaine au service d'une détection rapide et d'une réponse coordonnée. Cette capacité de détection repose avant tout sur un engagement au plus proche du terrain. Je souhaite à ce titre rendre hommage à une profession qui incarne au quotidien l'esprit même de l'approche globale One Health. Nos vétérinaires, trop souvent perçus sous le seul prisme de la santé animale, ils sont en réalité des acteurs majeurs de la santé publique et en première ligne de notre sécurité sanitaire. Par leur expertise clinique, biologique, épidémiologique et leur présence constante dans les territoires et dans les élevages, ils sont bien souvent les premiers à détecter les signaux faibles. Mais cette vigilance de terrain ne prend tout son sens que parce qu'elle s'inscrit dans des dispositifs collectifs structurés. En France, les plateformes d'épidémiosurveillance consacrées à la sécurité de la chaîne alimentaire, à la santé des animaux et à la santé des végétaux, coordonnent la collecte et l'analyse de données dans leurs domaines respectifs. Elle favorise la collaboration entre acteurs publics et privés afin de détecter précocement les risques, améliorer la prévention et orienter les décisions en matière de santé au service de la décision publique. Enfin, nous faisons aussi le choix d'associer la société dans son ensemble à cet effort de vigilance. Avec la plateforme de recherche participative CITIC, nous mobilisons à la fois les citoyens et les chercheurs pour mieux comprendre et cartographier les risques liés aux tiques sur l'ensemble du territoire. Parce que la prévention ne peut être efficace que si elle est partagée, comprise et portée collectivement. Au fond, ces actions traduisent une même conviction. La prévention des maladies, des zoonoses en particulier, ne peut être sectorielle, elle doit être globale. Elle ne peut être fragmentée, elle doit être coordonnée. Elle ne peut être nationale, elle doit s'inscrire dans une dynamique internationale. Enfin, mesdames et messieurs, nos efforts nationaux resteraient vains sans une coopération mondiale active. À cet égard, la France soutient pleinement l'alliance quadripartite. Nous portons également avec détermination l'initiative internationale PRESOD lancée en 2021. PRESOD incarne l'esprit de ce sommet. Comprendre les mécanismes d'émergence des zoonoses pour agir avant qu'elles ne deviennent des pandémies en associant recherche et innovation à l'échelle planétaire. Pour conclure, je reviendrai sur l'urgence d'ancrer de façon pérenne l'approche One Health dans nos sociétés. Nous devons cesser de réagir aux crises pour apprendre à les anticiper collectivement. Cela demande de l'innovation, de la coopération et surtout une volonté politique commune. C'est tout l'enjeu de cette session. Je suis impatiente d'entendre les experts et les ministres présents, que je remercie, avec nous partager leurs solutions pour réduire les risques infectieux et protéger ensemble la santé du vivant. Je vous remercie.
Thank you for your inspiring words, Minister Geneva. Please invite you to take your seat. And I will now ask for our first keynote speaker, Ms. Priya Basu, Executive Head of the Pandemic Fund at the World Bank. Please, Ms. Priya, the floor is yours.
Your Excellencies, Ministers, and esteemed colleagues and partners, all of us in the room have experienced the catastrophic impact of a global health event. The COVID-19 pandemic saw the loss of millions of lives and trillions of dollars in lost global GDP. But it wasn't the first time that the world was faced with a pandemic, and it will not be the last. Experts predict that there's more than a 50% chance that another will hit us within the next 25 years. The likely cause of such a pandemic is why we are gathered here today. Scientists estimate that 3 out of every 4 new emerging infectious diseases in people originate in animals. And more than 6 out of every 10 known infectious diseases that affect humans are spread from animals. These zoonotic and vector-borne diseases are not a peripheral concern. They are at the center of global health security. The boundary between human, animal, and environmental health is under more pressure today than at any point in history, driven by climate change, land use change, and the relentless expansion of human activity into wildlife habitats. This is the defining pandemic risk of our era, and it demands a fundamentally different response, one that treats humans, animal, and environmental health as a single system. Since it was established in 2022, the Pandemic Fund, which is the only multilateral financing mechanism that's dedicated exclusively to pandemic prevention, preparedness, and response, now supports 67 projects across 128 countries and has a portfolio of $11.5 billion. It is driving measurable gains in the systems that detect, contain, and respond to infectious disease threats and outbreaks. Its distinctive catalytic model unlocks sizable international and domestic resources to support country and regional priorities. Through 3 funding rounds already, $1.4 billion allocated in grants have unlocked commitments of over $10 billion in additional resources from international sources, as well as investments by the recipient countries themselves. More than 12,000 facilities have been upgraded to strengthen surveillance and testing. More than 300 laboratories have been upgraded already or newly established, and over 140,000 health workers have been trained in pandemic prevention, preparedness, and response. And when I say health workers, we're talking of doctors, nurses, field epidemiologists, lab technicians, but also, very importantly, as the minister just said, veterinarians, animal health workers, farm rangers, park rangers, and so on. But numbers only tell a part of the story. So let me share, through a couple of examples, what these investments look like on the ground. In Ethiopia, for example, our multi-partner One Health project is designed to support the integration of over 200 veterinary laboratories into the country's national network of 2,500 human health laboratories. This connection is critical. A pathogen detected in livestock in a remote pastoralist community can now be matched against human surveillance data at the national level. Ethiopia is translating its catalytic financing model into durable preparedness and response capacity, and seeing measurable improvements in surveillance, laboratory capacity, and workforce readiness. Another example, Togo. With pandemic fund support, Togo operationalized its national One Health platform, bringing together ministries of health, agriculture, livestock, environment, and finance around a shared early warning system. So when the highly pathogenic avian influenza emerged in 2025 in Togo, its strengthened systems detected it within 4 days, a detection speed that simply would not have been possible before. The country has also delivered targeted training to veterinary officers and animal health workers in surveillance, food security, and outbreak response. To continue driving measurable gains in detection, containment, and response to infectious disease threats and outbreaks, we have just announced a new funding round targeting 15 countries with the highest risks, the greatest needs, and significant socioeconomic challenges. This round was just announced on the 1st of April. With about $244 million for this round, the new funding package aims to support the strengthening of capacities for pandemic prevention, preparedness, and response in these most vulnerable countries. This targeted round is an important step towards ensuring that countries with the greatest needs and often the least access to financing are not left behind and have the support required to strengthen essential systems. Ladies and gentlemen, the evidence is compelling, the science is clear, and the momentum is real. But we must be honest. Our work is far from done. The next pandemic is not a question of if, it is a question of when, and whether the world will be ready. Investing in pandemic prevention, preparedness, and response is a smart investment. Every dollar spent strengthening surveillance and early warning systems, every veterinarian trained in outbreak response, every laboratory connected to a national network is a dollar that could prevent the next outbreak from becoming a global catastrophe. The pathogens that threaten us do not respect the boundaries between species, between sectors, or between nations, and neither should our response. I thank you for your attention.
Thank you so much, Ms. Priya. I'd like to ask to the floor Mr. Amadou Sall, Executive Director of Manufacturing and Supply Chain of the Coalition for Epidemic Preparedness and Innovations, the CEPI. Good morning.
Mesdames et Messieurs les ministres, Excellences, chers invités, chers collègues, nous sommes à Lyon. Je vais donc commencer en français pour dire que je suis ravi d'être parmi vous et au nom de la CEPI. Je tiens à remercier le gouvernement français ainsi que tous les ministères concernés d'avoir organisé ce formidable sommet et de nous accueillir dans cette magnifique ville. Maintenant, je vais passer à l'anglais. Like my peers, I am here to call for urgent action to strengthen our defense against zoonotic disease that could become the next pandemic. This virus is not only put at risk our life, but also our economy, our security, and the world as we know it. And shifting weather patterns and changing human behavior are accelerating the frequency and the spread of these threats. We are already seeing this play out. Until up to last year, France annually reported around 30 cases of mosquito-borne chikungunya disease. Last year, however, a staggering 800+ cases were detected across the country. This surge was driven by the Asian tiger mosquito spreading the disease northward, and travelers returning from Réunion and Mayotte, which too had experienced an eruption of infection. And chikungunya is not an isolated case. The El Niño phenomenon is expanding mosquito breeding ground and helping spread the deadly Rift Valley fever in both livestock and people. Human encroachment into wildlife habitat is exacerbating the spillover of viruses harboring in bats like Nipah and Ebola. And modern farming practice have fueled the H5N1 infection in mammals and in people. The world remains dangerously vulnerable. A revolutionary new approach is needed to protect us from these vicious threats and even for new disease X. Launched nearly a decade ago in the aftermath of Ebola in West Africa, the Coalition of Epidemic Preparedness and Innovation, or CEPI, is dedicated to developing vaccines against the world's greatest epidemic and pandemic threats. Our ambition is to harness cutting-edge science to rapidly and equitably contain our outbreak before they become global catastrophe. At the heart of this goal is radical but achievable idea to create safe and effective vaccines against new virus in as little as 100 days. Backed by the G7 and G20, the 100-day missions represent roughly a third of the time it took the first COVID vaccine. Evidence shows that achieving this time frame could stop an outbreak at the source, save millions of lives, preventing economic chaos, and protecting world health security. A One Health approach is really key to meeting this 100-day target. First, we are expanding our knowledge on infectious disease. That's why CEPI is providing $10.3 million to achieve a pioneering study in East Africa to get a better picture of chikungunya prevalence in the region and what this could mean for future chikungunya outbreak. Second, we need better insight in what the next disease X might be. With academic experts, we are supporting a new artificial intelligence tool, VISTA, that will provide risk ranking on the virus most likely to spill over from animal to human. Third, we must continue to progress vaccine development. To date, CEPI has supported researching over 50 vaccine candidates, bringing the prospect of protection against long-neglected disease closer than ever before. In the next few months, following a deadly Rift Valley fever epidemic in West Africa, CEPI is looking to advance a local phase 2 trial of the University of Oxford vaccine candidate. We are also providing vaccine developers free access to our world-leading adjuvant library. This includes Osivax, a French-Belgian biotech based here in Lyon, who today announced they are using the tool to assess whether their influenza vaccines candidate can be boosted to provide longer, stronger immune protection, and help stop a future endemic in its track. Crucially, we are completing this research now, before the next outbreak begins. This avoids us starting from scratch when a new virus emerges and gives us a vital head start toward the 100-day mission. To succeed, we need to sustain political commitment, and I'm grateful for the French leadership to the Global Health and the One Health, spotlighting the importance of multilateral collaboration and continued investment. Changing the course of the pandemic historic start with better preparedness, and one else show us how to do it. Merci beaucoup and bonne continuation.
Thank you, Mr. Amadou and Ms. Priya, for your insightful messages. And now I would like to invite our next speakers to come up to the stage. Mr. Budi Sarkin, Minister of Health of Indonesia, please. Hello. Ms. Kaite Sal, Minister of Health and Hygiene of Guinea. Mr. Tan Kiat Hao, Senior Minister of State of the Ministry of Digital Development and Information and Minister of Health of the Republic of Singapore. Hello. Mr. Luis Planas, Minister of Agriculture, Fisheries and Food of Spain. Mr. Ibrahim Assi, Minister of Health and Social Action of Senegal. And Mr. Song Kwan Ling, Commissioner of the Korea Disease Control and Prevention Agency, KDCA of South Korea. And Ms. Nina Varken, Federal Minister of Health of Germany. State Secretary of Germany. Please. Because of the delay, we had a small rearrangement of the order. I will start the panel making a question to the Minister of Germany, to the Secretary of State of Germany, sorry. Mr. Secretary, Germany has been a long-standing advocate for global health security. From your government's perspective, what are the strategic pillars of your national One Health roadmap to address the rising threat of zoonotic risks globally? Please.
Thank you, Chair. Let me express a deep appreciation to France for hosting the One Health Summit and for addressing this important topic. Zoonotic and vector-borne diseases represent one of the most important areas for the One Health approach, since 75% of emerging human infection diseases have an animal origin. Addressing this challenge requires an approach across sectors and disciplines. Effective monitoring and surveillance in all areas are essential for early detection and response. In addition to surveillance, strengthening research on zoonotic diseases is another important pillar of pandemic preparedness. Germany actively supports a strong research community on zoonotic diseases that work together following the One Health approach. Furthermore, national funding of our research networks, pandemic prevention and response strengthens collaboration on zoonotic pathogens and antimicrobial resistance in Germany. With this program, the German Ministry of Research funds 2 networks focusing on mosquito and tick-borne infections with 6.5 million euro for the next 5 years. Building on previous work related to zoonoses, a research agreement for One Health was signed in 2022 by 6 German federal ministries. Based on this agreement, the so-called One Health platform was funded for 5 years. It facilitates the coordination of research projects in Germany using the One Health approach. Finally, in order to reduce the chance of the next pandemic, we must also put more emphasis on protecting biodiversity. Therefore, following our national biodiversity strategy, efforts are being made to restore intact ecosystems in 21 action areas. Because we all know that environmental degradation decreases the likelihood of disease emergence. Besides our national efforts, we consider international cooperation on zoonotic diseases as vital. My ministry invests around 16 million euro this year through the Global Health Protection Program to enhance readiness, prevention, and response to infectious illnesses such as dengue fever or mpox and zoonoses in general. Germany is committed to strengthen pandemic prevention and preparedness through its supports for the Pandemic Fund, particularly in low and middle income countries. Here, too, the One Health approach is firmly anchored as a guiding principle. Furthermore, Germany supports countries in the Global South in preparing and responding to disease outbreaks through the German Epidemic Preparedness Team. Since 2015, this team has been deployed over 70 times in around 40 countries, for instance, to combat bird flu or mpox. For Germany, the One Health approach is a pioneering compass to address health risks such as those caused by zoonoses. We are therefore pleased to express our support for the following high-level deliverables on One Health proposed by President Macron. We endorse the scientists' declaration as well the commitments by states on restricting the intentional addition of micro and nanoplastics in everyday products. Germany further supports the deliverable on the impact of urban environment on mental health, which integrates One Health into urban planning. And last but not least, we welcome the overarching goal of the OECD deliverable to assess the economic impact of One Health policies. Thank you very much.
Thank you, Mr. Secretary. Thank you. And now going forward with Minister Buddy, please. Minister, Indonesia has deployed important efforts to manage zoonoses under the One Health framework. We would be very interested in understanding how Indonesia operationalizes its approach and what you have identified as key ingredients for a successful approach.
After the COVID in 2022, Indonesian government established a national committee on One Health. It's led by the coordinating ministers. I'm the member, including with the agriculture minister, who is responsible for animal health, and also environmental minister that's responsible for environmental health. And there are several initiatives that we have launched. The first one is on the surveillance side. So in Indonesia, healthcare sector, human health has the strongest. With the help of World Bank, we received a $1 billion loan to equip all public health labs with genome sequencing capacity at 34 provinces and also 514 cities with molecular testing facilities. We are very lucky because last year, We tried a new technology in molecular testing in 500 primary healthcare clinics. Very successful. This year we will buy 5,000 of it, and by the end of next year, 10,000 primary healthcare clinics in Indonesia have the facility of molecular testing. So this will create a massive surveillance infrastructure. Now the challenge is how we integrate this and use this facility for animal health and also environmental health. We are now working with our colleague in Agriculture Ministry to make sure we can use this facility not to duplicate the capacity, for also to monitor, to do surveillance in animals. The second initiative that we have done is on the production side. Indonesia, before COVID, have one vaccine company, produce 2 billion doses every year. Now we increase the capacity to 3.5 billion doses human vaccine, which is become 3 companies. Now, for your information, Indonesia raised a lot of chickens because we love chickens. So I just noticed in 2023 that the chickens need vaccine close to 5 billion vaccines every year. So much more than the vaccine needed for humans. So what we are doing now is we try to integrate these 2 types of vaccine companies. And indeed, one of the new human vaccine companies is an animal vaccine company. So the technology is slightly different, but they are still producing the same logics of vaccines. And we would like to combine this expertise so we have a buffer in terms of vaccine manufacturing capacity. The third initiative that we are doing is on the research and development. So we integrate the research capacity. It's not yet successful, but started already. So the researcher in animal vaccine and diseases now sit together with human researcher. It is not easy, especially when you have to make the human doctor sit together with the animal doctor. That is a communication things that we have to manage. But now it started. And thanks to CEPI, because CEPI helped us and give a donor 1 mRNA research and production facility to Biopharma, one of our state-owned vaccine company, and we are now opening up to all researchers, both in animal diseases and also in human diseases, because in human, to find a vaccine is complicated politically, socially, ethically, whereas in animal, you can do it faster. So if you can have a preparations on to do a research in animal, it will be easier and faster when it migrates to human being. The last thing that I would like to share with you, we also do initiative in ASEAN region. So Indonesia is co-sponsoring the Asian One Health Network that has been established. We already signed ASEAN One Health Joint Plan of Action Plan, and one initiative we called ASEAN Pathogen Priority is already launched. We get a help from the Pandemic Fund to do this initiative. Again, my last point, this initiative, One Health, is not something that you can do it alone. You have to do this together. Because 1.5 billion people travel, international travel every year. And then where we have custom, which is good in identifying what goods you carry, but the custom are very bad to identifying what pathogen you carry. We have an immigration system and visa system, which is very good to identify the movement of people, but they are very bad to identify the movement of pathogen and vector, like dogs between Indonesia and East Timor, or mosquitoes between Indonesia and Papua New Guinea. There is no immigration system and visa can detect the movement. That's why, my friends, we cannot do this alone. We have to do it together, like the African friends that always saying me, if you want to go fast, you move alone. But if you want to move far, then you have to go together. Thank you.
Thank you very much, Minister Buri. Going forward with Ms. Kaite Sal, Minister of Health and Public Hygiene of Guinea. Please, Minister Sal. Effectively managing zoonotic reservoirs requires a synchronized effort. How are the different ministers in Guinea, from health to agriculture and environment, collaborating to build a unified defense against these infectious risks?
Merci beaucoup. Bonjour à toutes et à tous. Je suis ravie de me retrouver parmi ces éminentes personnalités pour discuter en ce jour symbolique de la Journée mondiale de la santé, d'une thématique qui nous tient tous à cœur, à savoir le One Health. En Guinée, depuis 2016, suite à l'épidémie d'Ebola, nous avons dépassé l'approche sectorielle pour avancer vers une approche plus multisectorielle. Donc en 2017, nous avons mis en place par arrêté conjoint des ministres de la Santé, ministre de l'Environnement et ministre de l'Agriculture et l'Élevage, un comité de pilotage One Health qui se réunit chaque 6 mois pour discuter des problématiques qui impactent les trois différents secteurs. Ces comités de pilotage les activités opérationnelles sur le plan opérationnel sont mises en œuvre au niveau régional, au niveau préfectoral, par ces mêmes types de comités qui prennent en compte la multisectorialité de la santé, mais aussi qui intègrent les forces de défense et de sécurité, les administrateurs locaux et les membres de la société civile. Nous faisons très fréquemment des investigations en équipe et des exercices de stimulation transfrontalière pour nous assurer que ce mécanisme il fonctionne très bien. En matière de renforcement de capacité, en République de Guinée, nous avons le programme FITP qui forme non seulement les professionnels de santé, mais aussi les professionnels des sectoriels, notamment l'environnement et l'agriculture. Récemment, en 2024, en matière de financement, nous avons entamé la mise en œuvre du programme régional de sécurité sanitaire, dont l'objectif principal est de renforcer les capacités du pays dans l'alerte, la surveillance, la riposte et la prévention des épidémies. Et ce programme d'un montant de 116 millions de dollars est financé par la Banque mondiale et est mis en œuvre effectivement par les 5 ministères sectoriels, l'environnement, la santé, l'élevage, la protection civile et l'enseignement supérieur. Je pense qu'aujourd'hui, nous avons les mécanismes qu'il faut pour nous assurer que sur le terrain, le travail il est structuré, il est coordonné et il nous faut comprendre mieux les zoonoses pour éviter ces maladies, mais travailler aussi ensemble étroitement pour nous assurer que nos interventions ont plus d'impact sur le terrain. Je vous remercie.
Thank you, Minister Sal. A question for Singapore. Mr. Tung Kiat Hao, in order to address the growing threat of zoonotic risks, the Republic of Singapore has developed an integrated and multi-sector biomonitoring approach. Singapore can also rely on strong regional partnerships. It would be very enlightening to hear your perspective on this unique approach you have there, please.
Well, Excellencies, ladies and gentlemen, bonjour. Let me join my fellow panelists in first thanking the French government for your leadership in organizing this important One Health Summit in this very beautiful country of yours and this beautiful city of Lyon. Singapore is honored to be here to share our perspectives, exchange views with experts, and learn from best practices in many other countries. Well, Singapore takes this risk very seriously. Let me provide some context. We are a small island nation of 6 million people, smaller than the population of Greater Paris area. We are at the crossroads of global trade and travel. We host 1 million foreign workers in Singapore, and we import more than 90% of our food. And in Singapore, we welcome 16 million visitors into Singapore annually. That's almost 3 times our population. And our airport, Changi Airport, is one of the world's busiest, handling close to 70 million passengers last year. So that's almost 10 times our total population on our little island. So a disease outbreak in any other part of the world reaches Singapore shores in a matter of hours. So we are very alive to this risk and a firm believer of the One Health approach and a multilateral global response. We have adopted the One Health approach since 2012. Previously, This work was coordinated through the Ministry of Ministry of Health, my ministry. In April last year, in 2025, we established the Communicable Diseases Agency, or CDA, as the lead agency to coordinate our One Health efforts. We also launched the One Health Master Plan in November last year, which sets out Singapore's priorities over the coming years, of which one key priority is to strengthen biosurveillance capabilities through technologies to better detect, monitor, and respond to diseases that are at the intersection of human health, animal health, and environmental factors. Diseases such as many others have mentioned, avian influenza, rabies, dengue. So One Health is a multi-sectoral approach. The CDA works with agencies such as Singapore Food Agency, the National Parks Board, the National Environment Agency, and PUB, Singapore's National Water Agency. While each agency plays a distinct role, but the key is to work together in partnership at the human-animal environment intersection. So one example, Singapore's management of the mosquito-borne disease, Zika, by leveraging case-based monitoring and wastewater surveillance and mosquito surveillance, our agencies work closely to integrate signals from multiple sources of information so that they can better anticipate where the mosquito and Zika clusters are and step up precautionary effort. This is underpinned by innovative data analytical capabilities and scientific innovations, such as a homegrown gravity trap network, which allows us to monitor mosquito populations around our island. And by tightening the feedback loop between implementation and monitoring, we could accurately track the progress of our effort and reallocate resources accordingly. And since then, we have not had a Zika cluster outbreak in Singapore since 3 years ago. So this experience reinforced the importance of the One Health approach is only as effective as the strength of multi-sectoral partnership. As mentioned earlier by my esteemed fellow Minister, Pak Budi from Indonesia, Singapore, together with ASEAN, is a firm advocate of regional and global health, One Health cooperation. For example, in 2024, Singapore, together with the Food and Agriculture Organization of the United Nations, led a regional effort to develop guidelines for monitoring and surveillance of antimicrobial resistance and bacterial pathogens in aquaculture. And earlier this year, Singapore hosted the first Southeast Asia One Health regional workshop on avian influenza, bringing together experts to develop multi-sectoral prevention and control strategies. And next year, in 2027, Singapore has the honor of taking over as the ASEAN chair, and will host the ASEAN One Health Network. These platforms together allow us to strengthen regional cooperation and also interface with global networks in this global One Health effort. So Singapore's One Health effort reflects our belief that health security is a shared global endeavor. Health threats do not respect geographical boundaries, and our response must be equally borderless. Singapore is committed to deepen collaboration with international organizations and like-minded countries. Once again, I'd like to thank the French government in organizing this One Health Summit and look forward to hearing views and learning from best practices. Thank you.
Thank you, Minister. Before going forward, we need to please the owner of the red suitcase in front of the stage. If you could please collect your suitcase before going forward. We have to make sure it's not, the suitcase is not here anymore, please. Just to make sure, it's a red suitcase in front of the stage. Yes? Okay. Thank you so much. So this was quick. Going forward, please, a question to Spain now, Mr. Luis Planas. Minister, as we look to strengthen our global defenses, it is clear that animal health is a cornerstone of the One Health approach. From your perspective, how is Spain integrating animal health priorities into its national health security strategy to effectively prevent and manage zoonotic risks at their source?
Oui, bonjour, mesdames, messieurs, chers collègues. Merci pour l'invitation du gouvernement de la France pour être présent dans cette rencontre aujourd'hui à l'occasion de la journée internationale mondiale de la santé. Je dois dire comme début que ma collègue Annie Gevenard, au début de cette session, faisait mention du 75% en tant que donnée approximative des nouvelles maladies qui ont une origine zoonotique et quelquefois vectorielle. C'est une donnée certaine et c'est un vrai risque. Alors, il faut faire face. Et il faut faire face, et je crois que One Health, une seule santé, nous transmet pas seulement une idée, mais aussi une stratégie pour répondre à la santé publique, à la santé animale et à la santé environnementale en liant entre les trois aspects du point de vue de la réponse à donner face à ces nouveaux risques. Ça suppose bien sûr une coordination administrative. Je crois que dans tous nos gouvernements, les départements de la santé animale, de la santé publique et de l'environnement y sont impliqués. Mais il faut aussi une implication, c'est le cas de l'Espagne, des universités, des centres de recherche, des sociétés médicales, des professionnels qui ont des instruments et aussi l'expertise pour pouvoir répondre à cette situation. De ce point de vue, l'expérience de l'Espagne depuis 2023, avec notre plan national de prévention, de surveillance et de lutte contre les zoonoses, les épisodes zoonotiques d'origine vectorielle sont très importantes. Par exemple, en traitant des sujets comme le virus du Nil occidental, le fièvre de la vallée du Rift, ou bien la fièvre hémorragique de Crimée-Congo, qui sont des bons exemples des sujets dont nous devons traiter. Nous le faisons au niveau national, mais aussi au niveau européen. Nous avons un programme de suivi, de surveillance des vecteurs en Espagne. Si vous prenez la géographie, mais aussi notre présence, si je peux dire, géographique, mais aussi climatique, nous sommes à la croisée de chemin entre l'Europe et l'Afrique, mais aussi pour les conditions climatiques, particulièrement avec le changement climatique, les températures plus hautes, plus des épisodes que nous avons certainement de sécheresse, donnent, combinés avec des instruments de présence de zones humides, de marais ou de zones irriguées, une situation parfaite pour trouver ces éléments. C'est pour ça que tant les moustiques que les tiques se trouvent à l'aise et il faut en faire un suivi renforcé. Je crois que ce cadre de ce projet européen nous permet, et on faisait déjà référence ce matin au début de cette séance, sur la harmonisation des données du point de vue des échantillons, des analyses, mais aussi des diagnostics que nous faisons par rapport à tout ça. Et effectivement, c'est la coopération internationale qui est un des meilleurs instruments pour le faire. Et nous avons l'OMSA, nous avons la FAO, nous avons l'Organisation mondiale de la santé, nous avons l'Organisation des Nations unies pour l'environnement. Je suis ministre de l'Agriculture, je traite particulièrement avec l'OMSA et avec la FAO, et je dois rendre hommage à leur travail, celle de l'OMSA du point de vue technique et professionnel en donnant réponse aux questions que nous adressons aujourd'hui, mais aussi d'une façon complémentaire, celle de la FAO, en faisant des réponses sur le terrain, sur des projets concrets, sur l'implication dans le cadre d'une seule santé de réponse à tous ces problèmes. Le cadre qui va être prochainement mis au jour par la FAO dans le cadre des maladies transfrontalières qui ont un caractère zoonotique et qui peuvent effectivement affecter notre santé publique sont très importants. Je conclus, je crois que nous avons une expérience commune, une volonté de travailler en commun qui est très très importante. Chacun a ses expériences nationales, mais il faut les développer du point de vue de la coordination internationale clairement et à travers les organisations dont nous faisons part. Initiatives comme celle d'aujourd'hui que nous tenons à Lyon, c'est un bon moment pour rappeler cette approche et pour continuer, pas seulement sur la prévention, mais sur la surveillance et sur la réponse d'un des grands défis que nous avons dans un futur certain. Je vous remercie de votre attention.
Thank you so much, Mr. Minister. And going forward with Senegal, please, Dr. Ibrahima. Senegal has recently navigated specific zoonotic challenges, including outbreaks in late 2025. Based on these experiences, what successful initiatives or lessons learned would you like to share with the international community today, please?
Merci beaucoup. Je voudrais d'abord, au nom du président de la République du Sénégal, remercier les organisateurs de ce sommet, en particulier son Excellence, Monsieur le Président de la République française, Emmanuel Macron, pour avoir su inscrire la santé mondiale au cœur de l'agenda politique international. Vous savez, en été dernier, le Sénégal a eu à faire face à la gestion de 3 épidémies. Il y avait l'épidémie de la fièvre de la vallée de Rift et l'épidémie de la dengue ainsi que l'épidémie de mpox. Maintenant, aujourd'hui, si je ramène à leur contexte, il faut dire que pour nous, le sommet One Health, c'est vraiment le sommet de la science à l'action. Parce que l'enjeu, c'est comment faire travailler des secteurs, différents secteurs ministériels, différentes approches scientifiques pour arriver à des solutions qui peuvent être mises en œuvre si on arrive à mobiliser l'ensemble des acteurs, mobiliser les ressources autour d'une organisation parfaite. Et c'est ce que nous avons essayé de faire quand il s'agissait de la riposte par rapport à la fièvre de la vallée de Rift. Et nous avons été alertés depuis l'année précédente par des signaux climatiques qui disaient que le virus de la fièvre de la vallée de Rift est en train de circuler et qu'on avait le réservoir qui existait déjà au niveau des animaux et qu'on a pu détecter des mares qui étaient positifs. Mais la détection, quand même, pour cette année, n'a pas été rapide du côté animal. C'est pourquoi la maladie a circulé. Il a fallu qu'on ait des cas humains pour qu'on puisse retourner pour voir ce qui s'est passé au niveau du cas animal. Et on s'est rendu compte qu'il y avait beaucoup d'animaux de bétail qui étaient contaminés. Et c'est ce qui fait qu'en termes de cas, on est passé de 10 cas qu'on avait l'année précédente ou les années en 2022 à 561 cas avec 31 cas de décès, ce qui ne s'est jamais produit. Et l'approche que nous avons mise en œuvre, c'était d'abord d'assurer une très bonne coordination multisectorielle. Il fallait impliquer l'ensemble des secteurs dans la réponse. On a eu les vétérinaires avec l'élevage, l'agriculture. Nous avons eu le ministère de l'Environnement parce que le problème des inondations, le problème des mares. On a eu le ministère de la Santé, mais également le ministère de l'Hydraulique et de l'Assainissement. Et on a même pu mobiliser l'éducation nationale, mobiliser la communication parce qu'il fallait aussi que les communautés soient engagées autour de la surveillance que nous avons voulu mettre en place pour qu'on puisse détecter de manière précoce les cas et de pouvoir les prendre en charge de manière précoce pour assurer un taux élevé de guérison. Et cela nous a amené aussi à accroître nos capacités litières parce qu'on s'est rendu compte que comme on avait l'épidémie qui s'est propagée un peu partout au niveau du pays, il fallait qu'au niveau des centres de soins, au centre de traitement, qu'on puisse organiser qu'on puisse renforcer les capacités litières. Maintenant, en termes de leçons apprises concrètement, on s'est dit que quand on est en face d'une épidémie pareille, il faut faire une bonne cartographie des foyers épidémiques. Quand on fait la cartographie des foyers épidémiques, on adopte ce qu'on appelle la stratégie des tirs groupés autour des foyers épidémiques. Donc, l'ensemble des interventions, que ce soit la recherche des sites larvaires, que ce soit la lutte antivectorielle, que ce soit la surveillance pour retrouver des cas, que ce soit la prise en charge, que ce soit la communication, que ce soit la vaccination, nous avons essayé de les circonscrire autour des foyers pour qu'on puisse maintenir au maximum la propagation de cette maladie. Deuxième aspect qui est extrêmement important, c'est le renforcement de la surveillance collaborative avec l'aide du Pandemic Fund de la Fondation Gates. Et là, je profite aussi de l'occasion pour saluer l'apport de la Fondation Gates, mais surtout le Pandemic Fund qui vient aussi de donner un grant à l'État du Sénégal dans le cadre de la riposte par rapport aux pandémies qui permettront de renforcer le volet laboratoire, le volet surveillance, mais également le volet ressources humaines, avec au cœur du système la mise en place d'une bonne stratégie de recherche. On a aussi la disponibilité d'un stock de sécurité en intrants, les réactifs, les consommables, mais la disponibilité à temps réel des ressources financières. Et là, je tiens à féliciter et à remercier l'ensemble des partenaires qui sont mobilisés au niveau du Sénégal. Parce que souvent, nous, dans nos procédures en interne, parfois ça peut être lourd. Mais avec les partenaires, c'est flexible et ils ont agi à temps. Il y a aussi une autre leçon apprise qui est la communication. Quand les populations sont bien sensibilisées, ils ont la bonne information, ils contribuent à la riposte. Et la riposte devient beaucoup plus efficace. Autre aspect important par rapport aux leçons apprises, c'est le renforcement de la collaboration transfrontalière. On a pu bien travailler en intelligence avec la Mauritanie, avec la Gambie, la Guinée et le Mali pour voir s'ils étaient confrontés au même problème et de voir comment on peut avoir une action autour des frontières pour lutter contre cette maladie-là. Et j'ai beaucoup aimé l'intervention de Boudi. Il y a cela une semaine, j'étais au Burkina Faso, je dis qu'on peut avoir la police aux frontières, on peut avoir la douane, on peut avoir la gendarmerie, on peut donner des visas. Mais on ne peut jamais arrêter les virus, on ne peut jamais arrêter les pathogènes. Et on doit être dans une solidarité et une dynamique de coopération qui permettra d'aller lutter contre les maladies là où ils émergent pour qu'on puisse être sûr qu'on circonscrit leur développement à travers le monde. Voici un peu les points que je voudrais aussi apporter en termes de contribution par rapport à l'épisode de la fièvre de la vallée que le Sénégal a eu à gérer durant l'été dernier. Je vous remercie.
Thank you very much, Dr. Ibrahima. And now going forward with the question for the Republic of Korea, Mr. Commissioner, as zoonoses necessitate increasingly proactive national responses, what specific measure is the Republic of Korea implementing to ensure that human, animal, and environmental health are balanced sustainably within your public health framework? Please.
First of all, I would like to express my sincere appreciation to the governance of France for hosting this valuable summit and high-level meeting on One Health. One Health is the key guiding principle and strategic approach in responding to emerging global challenges, including climate change and future pandemics. We are also pleased to participate as an invited country of the G7 and to have the opportunity to share Korea's strategies, policies, and governance in addressing zoonotic diseases. Since 2017, Korea has incorporated the One Health approach into its major infectious disease policies and programs in response to the growing risks of zoonotic diseases. Before the COVID-19 pandemic, the One Health approach was applied within the public health sector. However, following the pandemic, efforts have been strengthened to enhance a whole-of-government cooperation and response led by KDCA. To better prepare for future risks, Korea has selected 14 priority zoonotic diseases with high risks of outbreak through scientific analysis. We are also establishing a real-time infectious disease data sharing system across human health, livestock, and wildlife sectors. This integrated system will enable early detection of emerging variants and more effective containment of disease outbreak. In addition, to strengthen on-site response capacity of frontline personnel, Korea has institutionalized joint simulation exercise based on the Joint Risk Assessment operational tool. This exercise has been held twice a year since 2023. Also, it is supported by training and capacity building programs designed to enhance expertise among central and local government officials, as well as healthcare professionals. As a key initiative, Korea established the National Plan for the Prevention and Control of Zoonotic Disease as a sectoral implementation plan under the Master Plan for Infectious Disease Prevention and Control. This is grounded in the Infectious Disease Control and Prevention Act. The National Plan for Zoonotic Disease has been jointly developed by relevant ministries such as Ministry of Agriculture, Ministry of Environment, Ministry of Interior and Safety, and Ministry of National Defense. As a part of this plan, an interministerial zoonotic disease response committee has been established with KDCA as a leading agency. Through this response committee, a wide range of policy measures are being actively implemented through close interministerial collaborations. In the aftermath of the COVID-19 pandemic, the importance of joint response through interministerial cooperation has been strongly underscored. Accordingly, there has been a clear need to establish a legal foundation, one that institutionalizes governance mechanisms and enables the development and implementation of joint action plans. In this regard, the government of the Republic of Korea has amended the Infectious Disease Control and Prevention Act in 2025. Through this amendment, we have institutionalized the establishment and operation of a whole-of-government council titled as the National Integrated Management Council for One Health and Infectious Diseases. This includes the development and implementation of One Health-based joint response measures, and brings together not only relevant ministries, but also local governments. With the amended legal provision set to take effect this June, we are now positioned to move forward with full-scale implementation. This marks a significant milestone. It advances our efforts beyond the interministerial collaboration into a new level of joint response, thereby translating the One Health strategy into action. The government of the Republic of Korea remains committed to actively contributing to global efforts in addressing climate change, preparing for and responding to future pandemics, and enhancing international health security. Thank you.
Thank you, Mr. Commissioner, and thank you all the distinguished members of this panel, the ministers, for sharing your country experiences. This has been very enlightening. I would kindly ask you all to return to your seats, please. As we, please, thank you. Yes, please. Thank you. Thank you. Good job. Thank you so much. Thank you. Thank you, Mr. Secretary. Thank you. Thank you, Mr. Budi. And going forward, we will start the second part of this session. I would like to form the next panel. Dr. Soawapak Henjoy. Okay, just a second then. Oh, okay. I'm sorry. Yes. Excuse me. Hello? Dr. Soawapak Henjoy, Chair of PRESOD, please, already here. Yes, thank you. Also, Professor Javier de Paris, Director of Health Surveillance and Safety at the Regional Health Agency, ARS of Réunion. Welcome. And also, Dr. Luis Pizarro, CEO of the NDI. Please. Welcome. So, for us to start with the PRESOD initiative, Dr. Soawapak. As risk reduction is considered less costly and more effective than responding to pandemics, you have placed primary prevention of zoonoses at the heart of your strategy, bridging the gap between communities and civil society on the one hand and scientific and political stakeholders on the other, from the local to the global level. Could you tell us more about the solutions developed by your initiative, both in terms of risk reduction and detection and early warning systems? How do you manage heterogeneity, human, animal, and environmental health, and data inequalities between regions? How do you also ensure that the tools developed within an international network are useful for public decision-making and are applicable and beneficial at the local level? Thank you.
First of all, I would like to thank you for organizer that in providing me the opportunity to be here in this important forum, and it's a big honor for the representative of the PRESOD that needed to be here. And PRESOD is an abbreviation of the preventing of zoonotic disease emergence. So that's why we put prevention. It's the first word of our goal, our achievement that we focus on prevention. And for the prevention, I think everyone knows that the prevention's success is often invisible because the event doesn't occur, because we prevent well. So that's why how we can know that in the prevention, we need to invest as because it's invisible. That's why we have to use the proxy indicator. What is a proxy indicator? How we can reduce the risk, risk mitigation as source. And so we need to for the early response, early detection. And also we need to see the indicator about the cross-sector coordination. So from the T concept, risk reduction. When we say that prevention, we may think about a vaccine or the other thing. But prevention is more a deep meaning. Prevention is a for PRESOD. It means that we need to prevent at the least of SARS. And then I would like to provide the example of the prevention that we are doing under the PRESOD. PRESOD, we have in the program that we call a PREACT. PREACT, this is an operational program under the PRESOD that we implement in the many regions around the world. And the one country that we implement the PREACT program. In that area, we found that they have an incident of the rabies case in animal population, especially in dog. And as we know that rabies is kind of old diseases, but it's still really live to training for the other people. Of case fatality rate is 100%. And then, even for normal prevention, we say that, okay, if we would like to prevent zoonotic disease from animal, that means we just provide the vaccination to reach in the dog or cats to get a herd in the herd immunity for 80%. But for this area, we didn't just only in the prevention of the vaccine. And we investigate what happened within the area. That's why rabies is still high incident in animal, in dogs. And we also found talk within the wildlife sector. And we found that it still occurs in jackal. Jackal is kind of like a fox, but it's not a fox, but it's like a jackal. And that's we found a lot in the Southeast Asia. And then actually like the jackal is also help like help in the positive for rabies as well. And then we investigated and we found that most of the dog is like a stray dog. They away like live together at in the dumping sites. Because then this is kind of like when the urban area, they expand and land use, and then they use in like most at the edge of the forest, and then at the dumping site, they didn't well manage. That's why many animals, wild animal, and also dog, they came because they would like to find the source of food. And then after we see the problem, we talk within the people from in the local municipality. What happened? How we can manage the dumping sites? It means that we have to talk within the sheriff, within the local organization, that we need to manage dumping sites and to prevent the risks that may occur to the other animal and to the human. And that's why we can see that it's just not only human and animal sector, but we work with the environmental sector and also within the Interior Ministry of Interior. And that means we use that information, early detection, farming the animal, and then we do kind of involve in the car sector collaboration, and then we try to do in the risk of mitigation. That means we manage the dumping site. This is one of the example that we provide us what in the prevention in the term of preserve. And we expanded this idea to the other network, to the other relevant stakeholder, that prevention, we need more involvement and how we can expand the best practices and to see the importance. That's why we need to invest for the prevention. This is our concept of the resource and highlight for the prevention.
Thank you very much. Hello. Thank you very much, Dr. Hinjoy. I would also like to ask Dr. Charles Gore, Executive Director of the Medicines Patent Pool, to join us. I apologize for not calling you in previously. Please. Thank you. Please. Sorry. Going forward, please, a question for Professor Xavier, please. Professor, overseas territories in tropical regions are hotspots for the emergence of vector-borne diseases, whether in the Pacific, in the Caribbean, or in French Guiana, or in the Indian Ocean. What are the factors and determinants behind these outbreaks, and what sustainable scientific innovations have been implemented to combat vector-borne diseases? Are the factors and solutions developed common across the overseas territories or specific to each territory? Do you share your experiences and expertise across territories to combat these diseases? It's also important to be able to... No, sorry, this is the question.
Bonjour. Je tiens à remercier tout d'abord le ministère des Outre-mer et puis le ministère de l'Agriculture français de m'avoir invité, de représenter les territoires ultramarins. Donc la France a 5 départements d'outre-mer et plusieurs territoires dans la zone Pacifique aussi, avec la Polynésie et la Nouvelle-Calédonie. Qu'est-ce qui explique les émergences infectieuses dans nos territoires insulaires? Eh bien, nous sommes des îles et nous sommes exposés en fait à un énorme trafic aérien qui est intense, aussi bien pour des raisons logistiques, marchandises, nourriture, portuaires également, et un flux de passagers qui ne fait qu'augmenter d'année en année. Nous avons des échanges entre les territoires ultramarins français et la métropole, la France, bien sûr, mais également que ce soit aux Antilles-Guyane, dans l'océan Indien, dans le Pacifique, avec les îles qui sont proches. La Réunion fait partie de la commission de l'océan Indien, qui associe l'île Maurice, Madagascar, les Comores, les Seychelles. des pays insulaires avec lesquels nous avons des échanges constants. Donc, en permanence, nous avons aussi bien des marchandises qui sont susceptibles de transporter des vecteurs, des moustiques en particulier, des puces, voire, qui peuvent arriver d'autres territoires, des territoires insulaires proches en particulier, du continent africain. Et puis nous avons des passagers qui arrivent par vol aérien, qui eux sont susceptibles d'arriver en étant malades, porteurs de virus. Et sur chacun de nos territoires insulaires, nous avons des vecteurs qui sont prêts à transporter ces virus et à les transmettre à l'homme. Alors si je prends le cas particulier de la Réunion, on a une espèce d'Aedes albopictus qui a cette particularité d'être un très très bon transmetteur du virus chikungunya. Et on a vécu une formidable épidémie, spectaculaire en 2024-2025 de chikungunya. Le virus a été introduit au mois d'août 2024 sur l'île de la Réunion. C'est une souche qui, a priori, provenait d'Asie. Et elle est arrivée sur un territoire où nous avions eu, 20 ans auparavant, une très grosse épidémie. Mais la proportion de personnes qui avaient conservé une immunité contre le chikungunya était retombée, était probablement aux alentours de 20%, voire peut-être un peu moins. Ce qui fait que nous avions 80% de la population qui était susceptible de faire la maladie avec un moustique qui est un très bon vecteur de virus. Et c'est ce qui a permis à cette épidémie d'éclater. Alors j'emploie le terme éclater parce que le chikungunya, c'est une épidémie qui est très intense, très rapide. Et nous avons vécu une épidémie où, à la fin de l'épidémie, après une enquête de séroprévalence, nous avions cette fois-ci 66% de la population qui était immunisée. Donc si on enlève les 20% que l'on avait conservés de l'épidémie de 2005, on peut dire qu'à peu près 45% de la population réunionnaise, soit un Réunionnais sur deux, a été victime du chikungunya durant l'épidémie, ce qui est absolument énorme. Et ce qui vous montre la capacité des arbovirus à déclencher des épidémies sur les territoires. On a eu de la chance parce que le virus n'était pas très virulent, on n'a pas eu beaucoup de cas sévères, on a eu des décès, bien sûr, mais beaucoup moins qu'en 2005. L'impact, par contre, il a été très important sur le plan économique. Donc on a lancé une étude d'évaluation économique de l'impact économique de cette épidémie, elle est en cours, on aura bientôt les résultats, mais c'est vraiment, que ce soit sur le secteur social, que ce soit sur l'économie, et puis sur les séquelles à long terme que peut laisser le chikungunya après l'infection, qui donne des complications articulaires chez les patients. Donc on a un impact qui n'est pas seulement sur le système de santé, mais qui est sur l'ensemble de la société et qui doit effectivement mobiliser toutes les ressources. Donc le mot One Health, il prend tout son sens face à ces épidémies d'arbovirose. Alors qu'est-ce que l'on a développé, nous, sur les territoires insulaires à La Réunion? Mais je vais parler du cas particulier de La Réunion, mais sur les territoires ultramarins français en général, on dispose d'une capacité de détection du virus et on a la chance de disposer de laboratoires experts qui nous permettent très rapidement de faire le diagnostic du virus qui circule. Je vous prends l'exemple de La Réunion. Devant toute infection chez l'homme qui fait évoquer un syndrome arboviral ou grippal, on fait systématiquement un diagnostic à la recherche de la dengue, du chikungunya et de la leptospirose. Donc on fait les trois c'est fait systématiquement en laboratoire. Ça nous permet une détection extrêmement précoce d'une possible épidémie. On a connu également, à côté de chikungunya, des épidémies de dengue. La dernière épidémie de dengue à La Réunion date de 2021. C'était un virus de sérotype 1. Donc là aussi, cette surveillance virologique nous permet de vérifier que la souche de dengue qui continue à circuler à La Réunion est bien toujours du sérotype 1 et qu'on n'est pas sous la menace de l'arrivée d'un nouveau sérotype susceptible de déclencher une épidémie. Donc là, sur le plan de la surveillance virologique, on est, on va dire, bien armé pour détecter rapidement les épidémies. Au niveau des professionnels de santé, on a des professionnels de santé qui sont bien informés, qui ont maintenant, je dirais, l'expérience, l'habitude de cette nécessité de surveillance et d'alerte précoce. Et donc, on travaille en permanence avec eux. Donc, les les médecins, les infirmiers, les médecins généralistes, premier recours en particulier, et les laboratoires, qui nous sont d'une grande aide. On travaille également à améliorer la lutte antivectorielle. Donc ça, c'est un élément très important de la riposte. Lorsque les premiers cas de chikungunya sont survenus, on dispose d'un service de lutte antivectorielle qui est d'ailleurs sous la responsabilité de l'Agence régionale de santé à La Réunion, qui intervient immédiatement dans un périmètre de 100 mètres autour des cas et qui va faire de la mobilisation sociale et, si nécessaire, une désinsectisation par pérétrinoïde. On a une stratégie d'utilisation raisonnable des insecticides pour éviter l'impact sur l'environnement, mais également pour éviter de créer des résistances. On a la chance à La Réunion d'avoir cette souche d'Aedes albopictus qui reste relativement bien sensible aux pyrétrinoïdes, contrairement à ce qui se passe sur le territoire des Antilles françaises, par exemple. Donc on veut absolument conserver cette sensibilité aux pyrétrinoïdes le plus longtemps possible. Donc on les utilise de manière vraiment raisonnée et stratégique. Donc une riposte aussi de la lutte antivectorielle qui intervient. Alors comment dès qu'un cas est confirmé ou suspecté dans un laboratoire de biologie, que la personne vient de se faire prélever, eh bien, on récupère les données cartographiques de l'adresse de la personne. Et comme ça, avec cette cartographie, on peut en permanence avoir sous les yeux l'évolution spatio-temporelle de l'épidémie. Ça, c'est vraiment une grande chance. C'est un système qu'on a pu monter grâce à la coopération de l'IRD, du CIRAD à La Réunion, et que l'on utilise en permanence et qui est vraiment très efficace, qui nous permet vraiment de cibler les périmètres où on doit intervenir géographiquement avec la lutte antivectorielle. On a pu, avec cette riposte précoce et efficace de la lutte antivectorielle, éteindre un des premiers foyers de chikungunya qui sont survenus à La Réunion au mois de septembre. Malheureusement, ça n'a pas suffi. On sait que la lutte antivectorielle n'est pas suffisante pour stopper une épidémie. Mais en tout cas, on a ralenti au maximum l'apparition du pic épidémique, ce qui nous a permis de nous organiser. Ce que l'on craignait, c'était surtout la saturation de l'offre de soins des hôpitaux, des urgences, si beaucoup de cas sévères étaient survenus. Donc on a pu organiser, prévoir, ça c'est très important, il faut disposer d'un plan, d'une organisation qui soit rédigé et qui soit vraiment efficace bien avant que l'épidémie survienne. Donc avec les multiples épidémies qu'on a à La Réunion, on dispose de ce plan, mais à chaque fois on sait se remettre en question, enfin un retour d'expérience systématique. Donc voilà la caractéristique un peu de la réponse que l'on peut avoir à La Réunion. On dispose de moyens importants, on a cette chance. On travaille également avec les services vétérinaires, avec le CIRAD qui est présent sur place, ce qui nous permet aussi d'avoir un lien lorsqu'on pourrait avoir des arboviroses, des zoonoses qui impactent à la fois les réservoirs animaux, les réservoirs humains, et on serait en capacité de faire le lien et d'avoir une intervention qui soit, je dirais, One Health, à la fois sur le réservoir animal, le réservoir humain. C'est ce qu'on fait d'ailleurs dans le cas de la leptospirose. On a cette année une grosse épidémie de leptospirose, et là on travaille en permanence avec les services vétérinaires, avec le CIRAD, donc c'est le monde de la santé animal et humain, donc le monde de la santé, version One Health, avec une dimension environnementale qui est absolument très importante pour la leptospirose. Donc l'influence du climat joue aussi sur toutes ces épidémies. Sur les arboviroses, alors l'augmentation de la température avec le climat peut avoir des impacts à la fois positifs ou négatifs. C'est un petit peu difficile à apprécier, mais on sait qu'à très haute température, le cycle du virus chez le moustique va se raccourcir, mais en même temps, le moustique devient fragile à très haute température. Bon, tout ça est difficile à apprécier, mais en tout cas, le changement climatique, c'est une variable que maintenant on doit prendre en compte dans la lutte contre les arboviroses, très certainement, et dans la lutte contre les épidémies qui sont susceptibles de nous toucher dans ces territoires ultramarins. Je terminerai en disant qu'on a la chance de nos territoires ultramarins français de pouvoir travailler avec la métropole, et on est vraiment en contact direct avec nos ministères, et ce qui nous permet de disposer de moyens supplémentaires s'il le fallait, et d'une expertise aussi supplémentaire s'il le fallait. On travaille également, je vous parlais de la communauté de l'océan Indien, évidemment que l'on échange les informations, on a une réunion toutes les semaines d'échange d'informations épidémiologiques entre tous les pays insulaires de la zone, ce qui nous permet de nous informer les uns et les autres et de, si je reprends l'exemple de l'épidémie de chikungunya 2024-2025, ça a permis d'informer les pays de la zone et qu'ils se préparent parce qu'on sait que la circulation virale va se faire de toute manière, quoi qu'il arrive, et ça leur a permis de se préparer et d'anticiper la survenue de la circulation du virus. Je vous remercie.
Merci beaucoup. Thank you, Professor. Going forward, Dr. Luis Pizarro, please. With the rise of arboviral and other vector-borne diseases driven by environmental, social, and climate factors, interventions have largely focused on prevention, including vaccine surveillance and vector control. Yet, the lack of effective treatments contributes to severe cases, deaths, and significant pressure on health systems, particularly for the most vulnerable populations. How is the NDI positioning itself to address this gap in treatments, and how do you ensure the development of therapeutics will deliver a comprehensive, actable response adapted to the realities of the most affected countries? Please.
Merci. Tout d'abord, je voudrais remercier le gouvernement français, non seulement pour organiser ce sommet, mais aussi évidemment pour inviter DNDi aujourd'hui à présenter notre travail. I'm going to switch in English to make things easier, and I will start by very quickly introducing DNDi. We are a global R&D organization trying to develop treatments for neglected population. Indeed, today almost 20% of the global citizens around the world are affected by diseases that we call neglected diseases, and they are neglected because there is no or not enough research for those diseases. People are poor, live in very remote places, and are not interesting the classical R&D pharmaceutical model. So at the NDI, what we have been trying to do is to develop alternative R&D models. And in order to do that, we're bringing around the table very different actors, of course, starting by the health workers that are very closely related to those patients, the ministries of health of countries where we find those diseases, but also the pharmaceutical sector that is eager to work with us, some philanthropics, governments, and regions, and is really trying to develop this collaborative model of research and development that we think we can make science and scientific knowledge a common good. This is the final objective we're trying to put in place. I was asked here to talk about dengue, because dengue, maybe you don't know, but it's still considered a neglected tropical disease in the list of WHO. And when you look at the world today, of course, with conflicts, with all those funding disruption, we know that climate change is making dengue, I would say, spread all around the world, and in countries like, for instance, my country, Chile, we never thought we will have dengue, and dengue is arriving now in the north. And here in Europe, countries like Spain, like France, they know already that dengue is a current threat for this region. So we would like to, of course, complement what you said before, because for dengue, we know that vector control, it's absolutely critical. We need to have important prevention strategies. We need to strengthen the diagnostics and to know better how to measure biomarkers for severe dengue. But we need to be able to develop treatments and particularly to avoid severe dengue. because the same situation that was seen here in Europe during COVID, when health systems were completely overwhelmed by COVID, is something we know dengue is able also to do in countries like Brazil, Peru, Argentina, in South America, of course in Thailand, in Sri Lanka, in India, but also we have seen that in Africa, like Burkina Faso, that has to face a severe outbreak of dengue. So bringing treatments is also a way to strengthen health system and of course protect citizens. And how we decided to address this very, very important challenge was to discuss first with the research team that were in those countries. So we had the opportunity to engage with Brazilian colleagues, Thai, from Malaysia, from India, and we decided that the best way to address this was to do science from the south to the world, and trying to create a dengue alliance, a South-South collaboration of scientific specialists on dengue, and to move all the actors and stakeholders who were interested to all together try to develop new treatments. And we were very lucky because the European Union and the European Commission was very soon interested to support this. And through HERA, the European Commission has decided to invest 20 million euros to support clinical trials for new treatments on dengue. So this is a real, I would say, breakthrough in the fight against dengue. And we are very happy also because it's creating a momentum at the international level. So we see that other countries are interested, and if you may, I would like to give the floor to my colleague from Kenya, who is here, Mary Muriuki Mutoni, who is the Principal Secretary of the Ministry of Health. I know that Kenya, that it's, by the way, one of the founding partners of the NDI, has decided to move forward and engage themselves on this. I don't know, Mary, if there is a mic for you here in the room. If not, I'm very happy to move and give you the mic. Please.
Thank you very much, ladies and gentlemen. As we gather here, recognizing that global health security is only as strong as its most vulnerable link. Today, dengue represents a growing and under-recognized threat in Kenya and our region, Africa. Confronting this challenge cannot be done in silos. It requires a robust global collaboration and truly inclusive research efforts. I am proud to announce that Kenya, operating through our premier institution, Kenya Medical Research Institute, is ready to join the Dengue Alliance. We commend the Drugs and Neglected Diseases Initiative and its partners for driving this vital initiative forward. Kenya stands prepared to contribute meaningfully, bringing our targeted scientific expertise, deep experience in infectious disease research, and active regional engagement in East Africa to the table. Crucially, we view this alliance as a fundamental opportunity to ensure that Africa is fully represented in the development of future dengue treatment. We cannot afford to be left behind in the pursuit of life-saving therapeutics. Kenya looks forward to working closely with DNDi and all international partners in advancing this shared agenda. I thank you.
Thank you so much, and thank you to the government of Kenya for being with us. And just the second and last point is that we're also very happy to announce today that the Thailand colleagues have also decided to engage here. And so I know that there is a video from our colleague, the Professor Dr. Visanu Meyo from the Thailand Science Research and Innovation Center. So I hope that the video could be...
Distinguished delegates and our host, the French government. It is a profound honor to join this collective mission at the One Health Summit. Thailand Science Research and Innovation, or TSRI, serves as the national agency responsible for formulating Thailand Science Research and Innovation strategic plan and allocating national budget to drive research and innovation across priority sectors. Through this role, TSRI ensures that research investments are aligned with national needs as well as regional and global health priorities. Under the strategic framework of the Science Research and Innovation Plan for Medical and Health, dengue has been identified as one of the key priority areas for Thailand and the ASEAN region. For Thailand, dengue is a national security priority. While we have seen a 1.8-fold decreases in cases in the first half of 2025, the threat remains hyperendemic, requiring continuous vigilance and sustained investment. TSRI is leading a unified front integrating science and innovation to move from containment to elimination. Our leadership is built on a formidable research foundation. Since 2020, TSRI has invested over $18 million in 183 strategic projects dedicated to dengue and related research areas. Through strong collaboration with leading institutions, including Mahidol University and Sariraj Hospital, we are advancing a robust vaccine pipeline at technology readiness levels from 3 to 6, alongside the development of industrial-ready diagnostics tools. Through TSRI, Thailand is advancing regional vaccine, R&D, and dengue control by strengthening partnerships, sharing tools, and promoting South-South collaboration to support practical, locally driven, and comprehensive approaches. TSRI is working closely with the Drugs for Neglected Diseases Initiative, or DNDI, to support collaborative research efforts that advance affordable and effective treatments for neglected diseases. This partnership strengthens our shared commitment to translating research into accessible solutions that directly benefit vulnerable populations. Finally, TSRI expressed its strong support for the Dengue Alliance and stand ready to provide financial contribution to the strengthening collaborative research and development efforts. We believe that collective action will be essential to accelerate the development of accessible dengue treatments and improve health outcomes across affected regions. TSRI reaffirms our commitment to working closely with partners across sectors and regionals as we move towards our shared goal of zero dengue deaths by 2030. Thank you.
Thank you, Dr. Pizarro and friends from the NDI. Going forward, with Mr. Charles Gore, thank you so much for joining us. Mr. Gore, the medicines patent pool plays a pivotal role in ensuring access to healthcare solutions. As we entered phase 2.0 from 2026 to 2030 of your mRNA technology transfer program, could you explain how this technology platform beyond human health is becoming a tool for pandemic preparedness within a One Health approach? Please.
Thank you very much indeed, and thank you indeed to the government of France for organising this great summit. France has been a tremendous supporter of MPP's mission to make sure that health products are available and affordable in low and middle income countries. So as you know, One Health means one world. It's vital, therefore, that low and middle income countries play a major part, not just in discovering threats to human, animal, and environmental health, but also in researching, developing, and manufacturing the countermeasures. This is the context in which to view the WHO MPP-led mRNA technology transfer program, so generously supported by France, right from its launch by President Macron, President Ramaphosa, and the WHO Director General. It's providing low and middle income countries with the ability to manufacture, and now as the program enters phase 2, also with the ability to research and develop those countermeasures. What is particularly relevant to this summit is the potentially transformative nature of RNA technology that offers the opportunity to bridge the long-standing divide between human and veterinary medicine. Historically, these two domains have evolved along separate and siloed technological and economic pathways. Veterinary medicines have largely relied on the attenuated or inactivated platforms that are not always compatible with human vaccine manufacturing environments. And conversely, recombinant and more advanced platforms developed for human use have typically been too costly or technically unsuitable for veterinary applications, given the differences in pricing expectations, adjuvant systems, and regulatory requirements. mRNA fundamentally changes that equation. For the first time, a single platform, leveraging the same facilities, equipment, workforce, and standard operating procedures, can be used to produce both human and veterinary vaccines. Such an approach has the potential to significantly improve the sustainability of local manufacturing by diversifying demand across human and animal health markets. Critically, however, there is a crucial constraint: cost competitiveness in the veterinary sector. Veterinary vaccines operate under much tighter price ceilings, and current mRNA products may not yet be economically viable. However, a key innovation that could change this is self-amplifying RNA, which dramatically reduces the dose required to achieve efficacy. Unlike conventional mRNA, self-amplifying RNA encodes both the antigen and a replicase complex. Once inside the cell, this replicase amplifies the RNA, enabling high levels of antigen expression from a very low starting dose. This dose sparing can dramatically increase output per batch and hence hugely reduce cost. The proposed vision for phase 2.0 of the mRNA program is therefore an integrated One Health manufacturing model, whereby a single facility could produce human vaccines for both routine immunization and pandemic response, human therapeutics, including emerging biologics and mRNA-based treatments, and veterinary vaccines targeting high-impact animal diseases. Within the veterinary domain, several priority issues are already emerging. Avian flu H5N1 remains a central focus due to its dual human-animal relevance, and our program partners are already developing a human vaccine with support from CEPI. Foot and mouth disease is another key priority given its significant economic burden, particularly in cattle. The program is currently engaging with a number of players and conducting due diligence and feasibility assessments to evaluate the potential for RNA-based solutions in this area. And in parallel, a broader landscaping analysis is being planned to systematically identify and prioritize One Health products that could be developed by program partners using RNA technologies, co-developed with entities outside the program, or indeed in-licensed. Phase 2.0 of the program is about creating the sustainability of our program partners to ensure their readiness to manufacture countermeasures in the next pandemic. In the interim, the One Health approach of researching, developing, and manufacturing products for human health, animal health, and for crossover intersectional diseases like H5N1 is clearly the way forward. Thank you.
Thank you so much, Mr. Gore. And ultimately, the message is clear. I think the effective prevention requires collective action across sectors, across borders, and with communities at the center, turning political commitments into concrete, sustainable implementation on the ground. Thank you so much for your participation here today. I will kindly ask you to return to your seats. And before going forward and asking for the presence of the director of Jabas Barbosa, I would like to just make two quick announcements. Thank you so much, please. First, please. Building on the critical role of innovation and production that was mentioned here several times, the Global Coalition for Local and Regional Production, Innovation and Equitable Access, established by the G20 Ministers of Health in 2024, launched its first call for proposals last week. The call focuses on dengue as the initial health challenge, underscoring the urgent need for more coordinated and equitable efforts to expand access to dengue-related health technologies. I invite you to visit our website using the QR code that was supposed to be put here in this slideshow, displayed on the screen to learn more about the call for proposals, this one. You can have more information regarding the coalition there. And second, as part of the important work led by WHO through the Collaborative Open Research Consortium, the CORC initiative, Oswaldo Cruz Foundation has been spearheading the development of a research and development roadmap on flaviviruses, which offers a comprehensive framework to support coordinated implementation and evidence-based decision-making across policymakers. The roadmap will be open for public consultation on June 3rd, and we warmly encourage your engagement. Now, without further ado, Mr. Jabas, please, if you could join us.
Your Excellencies, ladies and gentlemen, it has been a privilege to hear today's exchange and to see all presenters reaffirming a collective commitment to strengthen regional, national, and global health security through the One Health approach. One message is clear: this is no longer an aspiration, it's a necessity. When today's conversation has made it clear is that the threats we face are becoming more frequent, more complex, and more interconnected. Pandemics, antimicrobial resistance, climate shocks, and food system risks are deeply linked. Microorganisms do not respect borders, sectors, or mandates, and neither can our response. Diseases such as dengue, chikungunya, West Nile, and avian influenza are not only increasing in incidence, they are spreading into new territories. This underscores how deeply human health systems are linked to the natural environment. The most relevant point of agreement in the two panels that we had this morning is that no single sector can effectively anticipate or respond to these threats. They demand coordinated multi-sectoral action across local, national, and global levels. We are all seeing more complex viral dynamics with pathogens adapting in new ways. Highly pathogenic avian influenza has devastated the wildlife and food systems, and it is spread to more mammalian species, including humans, highlights the urgency of sustained genomic surveillance. Meanwhile, the continuous circulation of West Nile virus and the expansion of dengue vectors illustrate how climate pressures are reshaping disease patterns. These threats carry real health and economic consequences, affecting food security, trade, livelihoods, and ecosystems. Building truly integrated systems for early detection, risk assessment, and response is essential. In the Americas, PAHO has taken important steps to strengthen the region's capacity to anticipate and manage these threats. A key development is the upcoming launch of the regional One Health Laboratory and Genomic Surveillance Partnership implemented with Foundation Merrier, the PASSE Network, and several national public health institutions across the Americas. This partnership will enhance diagnostic, sequencing, and bioinformatics capacity for priority zoonotic diseases, strengthens regional laboratory networks, and integrates laboratory, genomic, and epidemiological data. We also emphasize that these efforts are expanding beyond the laboratories to operationalize One Health, surveillance in vulnerable areas such as the Amazon and Aryan corridors, where biodiversity, mobility, and environmental pressures converge. At the center of this work is the Amazon Aryan Network for Emerging Zoonoses with Epidemic Potential, which now has evolved into a platform for joint surveillance, share risk analysis, and coordinate preparedness across borders. This effort will be further reinforced by the pandemic fund-supported initiative Pivot, Prevention Infections Through Vigilance at the Origin of Transmission, to be implemented in partnership with the Inter-American Institute for Cooperation on Agriculture, IICA, FAO, the World Bank, and the Inter-American Development Bank, IDB. Pivot will expand the reach and depth of the Amazon Dairy Network actions. It will strengthen intersectoral risk assessment, enhance laboratory and genomic surveillance, and support shared tools to identify priority spillover risks. It also invests in risk communication, biosecurity, and policy development, preventing outbreak at their source while promoting sustainable multi-sectoral governance. Taken together, these efforts reflect a shared understanding that preparedness, prevention, and coordinated risk management are the most effective ways to protect populations, safeguard food systems, and preserve ecosystems. Look ahead, our challenge will be to align efforts from communities to national authorities to regional and global institutions, so we can ensure earlier detection, faster response, and stronger protection for the health of people, animals, and the environment. Definitely the most relevant conclusion from these two panels is that together we can build a future in which the world is not only more resilient, but better prepared to prevent the next epidemic or pandemic before it begins, and to face the current challenges that all countries in the world are facing nowadays. Thank you very much.
Thank you as well. This concludes the session. Thank you. Bye.
Thank you.